Heartbreaking. Local health officials say that's the only way to describe the crisis faced in many long-term care facilities, which are supposed to be taking care of our elders. They're investigating thousands of reports of abuse and neglect, unlike anything they've ever seen, and worry about what they're going to find even going forward after the restrictions are lifted and families visit their loved ones once again. In the First Alert investigation, Sarah Thompson shows us what she uncovered.
This is a very real concern for so many people as our population ages, impacting up to 1.2 million people nationwide. Wisconsin officials tell us it's become common to respond to complaints and find people so neglected they've been lying on the floor alone for a long time and no one knew it.
You're assuming that your parents or whoever is getting really good care, and oftentimes they're not.
Gina Schupp and her team with Brown County Adult Protective Services are on the front lines, called to investigate allegations of abuse or neglect in assisted living, nursing, and adult family homes or in private residences.
The people that we're seeing that are so bad now, they're ending up in the hospital. We've had several people that we've gone into their home and they've been in very, very poor shape. Some people have passed away.
Others are living in deplorable conditions, often in their own homes, but not able to care for themselves.
A lot of people with rodents, mice, they have animals that they're not able to take care of. I mean, again, if you think about someone who's not seen for a long time and they're not able to even get up and go to the bathroom, what kind of condition they're in.
There has always been concern, but Schupp says it's now reaching a level never seen, all because this vulnerable population is doing just what has been asked of them during the pandemic.
They're not being seen by people, so no one's making those reports to us.
Out of sight, out of mind, and we don't know what's happening.
As we started researching, talking with local and state health investigators, we discovered elder abuse or neglect reports in every corner of the state.
The cases have always been there, but they're more severe.
We requested data from DHS last month, asking how many complaints it's received involving nursing or assisted living facilities during the pandemic. The agency says it has an antiquated reporting system, but recorded more than 10,000 cases of abuse of adults in 2019, the most recent data they could give us, but added complaints and concerns have increased since the pandemic. To find out how many, we were told to search the thousands of records in the state's online database, one by one. We started with assisted and adult family homes, the ones state investigators say are the source of most problems. We looked at 175 of them in Brown County, where Gina Schupp's APS team investigates. We found 16 cited for neglect or abuse in the last year. Most of them also fined thousands of dollars by the state's regulatory agency. The reports revealed injuries and deaths of people living in long-term care facilities. Some were from COVID-19 spreading through facilities. In one home, 8 residents died. In another facility, 2 residents. We also found cases of staff not wearing PPE. In another facility, employees testing positive but still coming to work. But we found more incidents of neglect and abuse not related to the coronavirus, including multiple facilities not giving residents their medications. At one place, 2 people missed 164 doses of needed prescriptions in just 3 months. We also discovered findings of inappropriate care, like a resident who broke their leg when staff pulled on their clothing and they fell out of their wheelchair. The common factor in multiple complaints?
That they don't have enough staff. Undertrained, underpaid, so oftentimes they're required to work double shifts.
In one case last summer, police were called when an entire staff walked out in the middle of the night, leaving 36 residents with just one unqualified staff member to care for them all.
People are not getting taken to the bathroom, they're not getting showered, they're not getting their 3 meals a day because the facility basically does not have the staff.
We've gotten some really tough cases like that. It's all due to the pandemic and lack of workforce.
The state is also tracking another form of abuse, financial exploitation, for the first time. Between scams and family members stealing from their loved ones, more than $25 million has been stolen from seniors just in 2020, with only 45 counties reporting so far.
And I can't imagine what the number is going to be when we have all 72 counties reporting. I was shocked.
In every case we found, whether neglect, physical or financial abuse, facilities were cited and most face large fines, but not a single criminal charge has been filed. State officials say that's a huge problem.
It isn't happening nearly as much as it should. Let's put it that way. APS for many, many years has been very frustrated with their ability to get law enforcement to pay attention to some of these cases, because law enforcement would say, oh, these are family matters. This isn't for us. And that's not true.
The challenge comes with the victims themselves. These officials blame age and memory, saying they're unfairly used against them. And in financial crimes, victims don't usually want to turn on their own family members who are stealing from them.
Those are cases that are tough to prosecute because you don't have real stellar witnesses. Doesn't mean you don't have a crime and you don't have a victim. It's just a case that's going to be difficult to win in court.
The state's Bureau of Aging tells us it was working on training programs to get these cases into the hands of police and prosecutors, but COVID-19 suspended that work. The state has developed a hotline to call about abuse and stresses you don't need proof, just a gut instinct will work and they'll take it from there. So what can you do right now? Ask a lot of questions about your loved one, about how they're eating, their medications, their behaviors, and try to physically see them in some way, either in person, through a window, or virtually. We have more resources and links so you can search specific facilities yourself, all at WBAY.com.